Right now, and for 2 days in a row, more than 90 COVID-related deaths reported for the state of New Jersey. Hospitalizations are up, so are the number of positive cases. How are officials trying to change this course, especially with an update of a vaccine? We have New Jersey Health Commissioner Judith Persichilli this morning. Good morning to you, Commissioner. Thank you for being here on an important morning.
Morning.
And I'm going to get to what the Jersey City mayor said in just a second about vaccine rollouts and some questions he had. But I want to talk about cases first. Positive cases continue to rise. These numbers are alarming with the number of hospitalizations as well. How are hospitals faring right now in terms of bed capacity?
Right now, our hospitals are okay. They have about 3,500 COVID positive patients in the hospitals. With about 600 individuals in the intensive care units, but we still have capacity. The hospitals have learned a lot from our first surge in April 14th and 15th, when we had 8,300 patients in the hospital and 2,300 patients in ICU. So they have PPE, they have ventilators, they have treatment protocols in place. Right now, they are doing okay. However, our predictive modeling shows that by mid-January, we may be right back to where we were in April. So we are working with our hospitals to plan for the surge. We believe in terms of beds and equipment, we will be fine.
You're saying you could see up to 13,000 cases by January because that's where you were around the peak. What are you attributing that to? Is this the Thanksgiving holiday issues of people gathering inside their homes?
Yes, it's a cumulative effect of all of the openings slowly building, increasing positive cases, and hence hospitalizations. We feel that the increase now is due to Thanksgiving gatherings, and we believe between Hanukkah, Christmas, holidays, Kwanzaa, and New Year's that we will see a significant peak.
You know, and because of all of the holidays that are happening, there is this push to get tested, right? However, there's a wait to get a test. And are people letting their guard down then, Commissioner? If you get a test and it's negative, you're like, I'm okay, I'm in the clear, I can have a gathering. What is your thought on that whole idea of testing and the lines people are waiting in?
We're doing a lot of public awareness around testing and the implications. We have 400 test sites in New Jersey right now. And I direct everyone to covid19.nj.gov, and you'll not only get information about where we are with the COVID pandemic, but you will also be directed to a site, a testing site near you. So 400 sites. We understand there is some delays, and our biggest issue is the delay between the test and the result. And for those individuals who are tested, and the result comes back in 2 to 3 days, we are asking you to isolate for 2 to 3 days till you are identified as either positive or negative. However, if you are negative, and our public awareness campaign is stressing this, that just means you're negative for that day.
Right.
All of the safeguarding needs to be in place.
Understood.
Mask up, indoors and outdoors. Socially distance, wash your hands frequently. If you're sick, get a test, call your doctor. All of the things we've been preaching at the beginning.
I want to pivot now to doses of the vaccine, which could arrive as early as Monday. Who is in charge of the distribution for the state of New Jersey, and how many doses are expected in the first shipment?
We have a team, a vaccine team, under the direction of Dr. Adenauer, our Deputy of Public Health, our Deputy Commissioner of Public Health. They have been working aggressively since the end of March around vaccine planning. So they are identifying with the federal government where the doses will go. We've identified Pfizer pre-positioned hospitals, and we will do the same for Moderna when it comes out. We expect vaccines either Monday or Tuesday if ACIP, the Advisory Committee on Immunization Practices, gives a thumbs up. We will expect some vaccine Monday or Tuesday, and hopefully by the end of the week start vaccinating.
Healthcare workers, nursing home residents, they're the first to get it. But we heard from Jersey City Mayor right now, who said there needs to be a clear process on the distribution, and he wasn't really sure if there was one. So how long will it be to vaccinate every single home? in New Jersey, and who determines the first healthcare workers and the first nursing home residents that get it?
We have a professional advisory committee that is made up of physicians and bioethicists from throughout the state that have identified the prioritization categories. 1A is clear. It's being dictated to us, and we agree with it. It's paid and unpaid healthcare workers that have the highest risk of coming in contact with infectious material, and our long-term care facility residents and employees. 1B follows the essential worker definition in CISA, and we've separated that out into health and safety, infrastructure, societal functions, and then there's a catch-all others.
So just for the timeline of every single individual within the state of New Jersey, what is your timeline? Is it summer 2021?
All right, our goal is 70% of the adult population to be vaccinated within 6 months. That is no secret. We have told every single person that, every single elected official, that is our goal. It's 4.7 million individuals, and we want to do that in 6 month period of time. We expect more vaccine to be widely available at the end of March, beginning of April. We will have 6 mega sites that will be functioning for a 6 month period where people can pre-register and get vaccinated, or they can walk up and get vaccinated. That's our goal. It's ambitious, but we're working aggressively on it.
Ambitious is good in this time. Health Commissioner, I know you also came in contact with someone. Just wanted to check in on how you're feeling.
I'm fine. I was quarantined for a full 14 days.
I know.
No symptoms. Thank you for asking, but I'm fine.
Okay, I'm glad to hear you're doing well. Glad to hear that your staff is doing well as well. Thank you for coming on this morning to navigate these roads to the vaccine. You're welcome back anytime. There's going to be a lot of questions. If I don't talk to you, have a safe and happy holiday season.
You too. Thank you so much.
Thank you, Commissioner.